In part 2 of this video, we are going to discuss about the types of lichen planus and various syndromes associated with lichen planus So, before discussing about the types of lichen planus, we need to discuss about very important thing is that lichen planus is always present bilaterally. That is, on both the side of the mucosa is always present bilaterally. Now let's discuss about the types of lichen planus. First one is reticular type of lichen planus. This reticular type of lichen planus, it is asymptomatic type. So in this, no treatment is required. No treatment is needed. And it is most common site is buccal mucosa. Most commonly. And on both the side, as we have discussed earlier. And it always contains most characteristic feature of this reticular type of lichen planus is that it contains intersecting white lines. More correctly named as Wickham's striae. Like these intersecting white lines like appearance. And this reticular type of lichen planus, it may not be evident on dorsal surface of the tongue. Dorsal surface of tongue. Now second one is the erosive type of lichen planus. It is symptomatic. Patient complains of lot of burning sensation. And these lesions are usually present along with desquamative gingivitis. And these are red areas which are surrounded with intersecting white striae-like appearance. So, red areas surrounded by intersecting white lines. Third one is the atrophic type of lichen planus. This atrophic type of lichen planus it also appears along with desquamative gingivitis. Fourth one is the hypertrophic type of lichen planus. This hypertrophic type of lichen planus, it often resembles leukoplakia. So if someone asks what is the differential diagnosis of lichen planus, do not jump and say that leukoplakia will be the differential diagnosis. Leukoplakia will only be the differential diagnosis of hypertrophic type of lichen planus. Fifth one is the bullous type of lichen planus. It is very rare type of lichen planus. Now let's discuss about the syndromes which are associated with lichen planus. First one is the Greenspan syndrome. When we are discussing about Greenspan syndrome, we should also know about Greenspan lesion. Greenspan lesion is associated with oral hairy leukoplakia. Lesion is associated with oral hairy leukoplakia, whereas syndrome is associated with oral lichen planus. So it is the triad of oral lichen planus, hypertension and diabetes mellitus. So if patient gives us history of diabetes mellitus, hypertension and oral lichen planus, then we are going to say that this patient is of Greenspan syndrome. Second one is the Graham-Little-Picardy syndrome. Graham-Little-Picardy syndrome. In this, patient has both oral manifestations as well as skin lesions. In these patients, lichen planus-like lesions are present, and these lesions involve lichen planus-like lesions are present, and these lesions involve scalp, where we will say hair loss, alopecia, axillary hair loss can also be seen, and nail involvement is also seen.